My name's Roseanne and I'm the lead outpatient physiotherapist at King Edward VII Hospital. And myself and my colleagues work very closely with the London Orthopaedic Clinic, and we see lots of patients with hypermobility, which is what we're focusing on this evening. So here we've got Simone Biles on the beam, and as we know, she did exceptionally well in this year's Olympic Games. She won 4 gold medals. She's hypermobile, and for her it's an asset. She has the muscle stability to support her joints. But for others, hypermobility can be a liability, and it can predispose people to a range of clinical problems. The patients we see at King Edward VII, they can vary. Someone might come in with an unstable shoulder. But often, you ask the patient where their pain is, and they present with a body chart like this. They simply say, "I have pain everywhere." We need to remember that there is a link between hypermobility and conditions such as fibromyalgia, chronic fatigue syndrome, chronic pain syndrome, anxiety, and it can lead to premature osteoarthritis. So what is the physiotherapy evidence with regards to physiotherapy management? It's growing. The reports have not always been positive. Some reports say that physiotherapy can exacerbate the patient's pain. But what we need to look at is why this is. And often it's because the physiotherapist has pushed the patient too quickly. They've been too vigorous in the session. These are the types of patients that come to you. You ask them when they get their pain and they say, "I felt really good, so I went for a 2-mile walk," or "I felt really good, so I did lots of housework. But afterwards, I was in so much pain, I couldn't do anything for days." The risk of this is that they're associating physical activity with pain, and we're at risk that they're going to get into this fear avoidance cycle. Yet we know that with hypermobility that they need to exercise. They need that muscle stability to support their joints. So us educating them on how to pace themselves is really key. So they can still do the housework, but perhaps spread it out over the course of the week. In our assessment, we're also going to treat what we pick up in our subjective and objective assessment. And there are some good reports out there to show that with a gradual strengthening program and a general holistic approach, patients' pain decreases and their muscle stability improves. So in terms of physiotherapy management, what are our priorities? First of all, it's really important we listen to the patient. Then we can set realistic goals, and it's more likely the patient's going to be motivated in the treatment process. We need to get their pain under control so that they can get exercise in. So we're going to work with the multidisciplinary team, make sure they're on optimum pain medications, but then there are adjuncts we can use in physiotherapy. So perhaps we find they've got a tight muscle. We can use soft tissue massage or trigger point release. We can recommend TENS, which they can use at home. We can use acupuncture. Just because they're hypermobile doesn't also mean that they don't have areas that aren't more stiff. So we can clinically reason that by us mobilising those stiff areas, whether it's of benefit to them or not. We don't want them to become so floppy that they don't have the muscle stability to support their joints. Once their pain is under control, we can start thinking about muscle strengthening and core stability. And often these patients are really deconditioned. So it's really important that in physiotherapy, we don't flare them up. We need to make sure that we're getting a good balance between rest and exercise. We're going to look at starting exercises in a non-weight bearing position in their hypermobile range, and we're going to look to progress it to more dynamic weight bearing exercises. At King Edward, we've got a hydrotherapy pool. Here we run 30-minute classes. There's 1 physio to 3 patients. It's great because they can perform exercises in the hydro pool that they can't perform on land. We're pacing them in the hydrotherapy class. We may start by doing hydrotherapy once a week, building it up to twice a week, and then progressing them onto the land-based exercises. We need to be working on their core stability. We know that if we improve their core stability, that can help to improve their peripheral joint stability. So I'd be looking at starting core exercises in the hydrotherapy pool and progressing it to more land-based core dynamic exercises. And then ultimately we want the patients to self-manage because we need them to maintain that muscle strength, if not grow stronger. So I'm really, really pro something like Pilates. We also know that with hypermobility, patients can present with impaired joint proprioception and a reduction in balance. So in our assessment, we're going to look at their posture, we're going to look at their gait. Perhaps here we pick up that they overpronate at their feet, or they hyperextend their knee, or they've got an unstable shoulder. So then, if they overpronate, we can refer to people like Justin for podiatry. If they hyperextend at their knee, we can use things like taping. This is great in the short term because it gives them that proprioceptive feedback as to what a normal knee should feel like. But as mentioned earlier, we then need to ensure that we're doing corrective proprioceptive rehab. We don't want them to become dependent on that tape or support. In terms of balance, I'd be looking to start it in something like the hydrotherapy pool, progressing it to land-based work, adding in things like your wobble board to challenge them more. And then here I've got reformer Pilates, which I particularly like. It's great because it challenges their balance, works on their core, but also works on that muscle strength. So it's good in terms of self-management. So in conclusion, physiotherapy is key when managing hypermobility. It's really important we pace the patients. That's in their everyday life, but also with the exercises that we prescribe. Get that balance between rest and exercise so we can work them through the treatment process so that they can self-manage. Thank you.